Hi everyone, I'm Chris Conte here on OpenLine. My guests tonight are Dr. Michelle Fiscus from the Tennessee Department of Health and Clark Flatt from the Jason Foundation. We are continuing this conversation now about suicide, something we've been talking about now for the last hour or so. I believe that we do have some callers. Myra is on line 3. She's been waiting for a little bit. Myra, can you hear us?
Yes, sir, I can hear you.
Okay, and what's going on?
Well, I'm an older person now. I don't guess I'm real old, but anyway, I have had depression, and I don't think that anyone can help anyone unless they have had depression, because unless you walked in someone's shoes, you don't. I never knew that depression could be so bad. Mine was clinical depression, caused medication, of course. But when you get to the point where you can't eat, you can't sleep, your mind can't focus on anything, and it's racing and racing and racing, and you can't focus on anything. And I'm a Christian, and I wanted to pray, but my mind had gotten to the point where the only thing I could say was just, God, help me.
It's all encompassing.
Mm-hmm. It is.
It is, and that's really, and it's hard for people to understand that if they haven't, I remember Samantha saying, there are some people who will never have a suicidal thought in their life.
Yeah, not everybody that's depressed considers or attempts suicide either. Right. But it is a struggle, and I would say that to especially those people who have struggled with it and have now got a new strength, like she said. They can make tremendous inroads in helping other people who are struggling with depression. So I definitely agree that those people who have struggled and learn how to cope with it can make a big difference. But I think we all can help.
And Myra raises a lot of the symptoms that we see as risk factors for people who go on to complete suicide. She's having difficulty sleeping. And teenagers will see them sometimes sleep too much when they're depressed, sometimes not be able to sleep at all. It can kind of go either way. She's having trouble eating. People who are depressed and maybe at risk for suicide as teenagers will see trouble with them eating, with them having social interactions, with them losing focus and not being able to complete tasks. So these are all things that we all need to be aware of when we have people in our community or in our homes that are maybe beginning to struggle.
And that's the thing. I mean, sometimes, the signs may not necessarily be someone in a bad mood or someone who just doesn't want to talk. It's just there's different things to look for sometimes that are out there.
It's just a change in behavior.
Yeah. Can you talk a little bit about, we talked about, Samantha was talking about this, kind of the ripple effect that this has. One thing, she was saying, especially in a school environment when this happens, the students, other people around this person who has died by suicide are now more at risk. And so there's ripple effects from this.
Yeah, the idea of contagion, which is a real threat. But a lot of times contagion is in my opinion, a result of how we handle a tragedy such as a suicide. As you mentioned, something that might sound very positive of pulling all the student body together and doing an assembly thing. Most professionals we deal with, I won't say all, but most would say that's not a good idea right after a suicide. So how we treat a suicide or a tragic event like that can have a lot. I think it's important to stress that it's not something, though, even though we have this now, as I said, when I lost Jason, it was the third leading cause of death. Today in our nation, it's the second leading cause. Only unintentional injuries, which include car accidents, takes more lives than suicide. But yet it is not something everybody's doing. Here in Tennessee, the Youth Risk Behavioral Survey 2015, almost 1 out of every 10 students surveyed said they had attempted suicide in the past 12 months. That's just a horrific statistic. But we got to also know that means 9 out of 10 didn't. The majority
Right.
of people are not
Right.
attempting, but still,
But
9.9%.
here, and so not even
Oh, it's too much.
saying thought about. You're
Right.
saying attempt.
Right.
Attempt, and
9.9% in Tennessee in the last survey. In
And we were
2010.
talking about numbers in terms of that too. I mean,
Yeah.
we talk about a lot of the statistics we have are deaths. We don't necessarily, and like you said, we'll never really know the full number of people who attempt, unless it gets to a point where they end up in the hospital
Right.
for some reason. Is the truth of the matter?
Right. So the good news about attempts, at least from the data that we have, is that the attempts have actually dropped fairly considerably over the last few years. What's interesting about that is that people who attempt are more likely to be white females, whereas people who complete are more likely to be white males. And so, and that goes along with the mechanism that a lot of times females are using drugs or as Clark mentioned, moving more towards trying to suffocate, but males are more likely to grab a weapon that is much more deadly, like a firearm or a knife or something. The other thing to consider is people in the audience might be saying, well, why do I even care about this? I don't know anyone who's committed
Right.
suicide. I don't have children in my home to worry about. But the economic burden of suicide was around $1 billion in Tennessee a year. And that comes from not only the loss of wages and productivity of the child who took their own life, but also for the people that child was connected to, the parents that can't work, or the people in the community that are affected by that. So, so it is something that everybody in the community needs to take a stake in.
And I think more often than not, it's someone somewhere. Most people have been touched by this, whether it's not necessarily directly or in their life, but somehow they have experienced
just
this
like
kind
you
of loss.
related to the people here. Once I'm fortunate enough to get around the country and do some coalition talks and state talks. Usually after that, it is hardly ever an instance. Several people don't come up
Right.
and want to relate something that happened.
Let's see if we can get to maybe one more call here. Linda on line 1. Linda, can you hear me?
Oh, this is Bob.
Oh, Bob. Hey, Bob.
Hey, I think it's a good program. Y'all doing some coverage, excellent coverage on the problem, but you cannot couch quarterback diseases and drugs and criminals. The epidemic of hepatitis C is affecting people the way they think. Drugs affect the way people think.
When we talk about the health epidemic, I mean that this is not being treated as a public health issue.
Right.
Is part of the problem here.
And it needs to be treated as a public health issue, and we're working towards doing that. Coalition building, working on education, trying to reduce the numbers of people who go on to complete suicide by educating the people around them.
Let's see if we can take perhaps our last caller here. I think this might be Linda. Linda?
Yes.
Sorry about that. Where are you calling from?
Calling from Nashville.
Nashville. Okay. And what's going on?
Okay, this I was telling the lady, I have a brother that committed suicide at a young age. And if I could advise any parents or anyone, I would say that you see signs in these people before something like this happens. They're either mixed in drugs or you're seeing them go through something that they can't handle. And if you can come together as a family and really pay attention to what this person's going through, give them a lot of love, give them support. Don't hide your head in the sand and not think something's happening.
Yeah. Not an easy thing to do.
Right, but Linda said
But
it
at least start the
perfectly.
conversation.
Yeah,
Take action.
Exactly.
Yeah.
Exactly.
Now, I've heard way too many times that we're brought into a school situation or community, regrettably after a fact, when somebody says, I saw something, I was about to say something, I wanted to act, and they did. And that's a terrible grief or burden to bear. If you saw something and you thought you should act, you can err on the side of caution. Always take action.
We're going to take a quick break and we will be right back after this.